Have you ever wondered why so many older people, maybe even you or someone you love, suffer from leg pain or struggle to walk like they used to? Well, grab a cup of tea and get comfy, because today we're diving into a topic that affects millions: why elderly people experience leg pain and what you can do about it. And trust me, it's not just about getting older. There are surprising and sometimes treatable reasons behind it. Now, walking seems simple, right? We do it every day without thinking. But did you know that walking is actually a very complex process? It involves your brain, your nerves, your muscles, your bones, your lungs, and yes, even your heart. So when something goes wrong in any of these systems, your gait, that's your walking pattern, can change. Add to that aging, arthritis, balance issues, or even mood, and you've got a perfect storm for leg pain and walking problems. Fun fact: people living in big cities actually walk faster than those in rural areas. Surprising, right? Let's talk about gait disorders, those changes in how we walk. According to medical studies, more than 10% of people in their 60s already show some gait issues, and that number jumps to 60% after the age of 80. But what causes this? Sometimes it's asymmetry. Maybe one side of your body is weaker due to a joint issue or nerve damage. Some people develop short steps or a shuffling walk. Others may experience retropulsion, where they suddenly fall backwards without warning. And if someone starts to lean forward while walking or looks like they're running to keep up with their own steps, that could be a sign of Parkinson's disease. So many different gaits, so many different possible causes. So what causes leg pain specifically in older adults? There are three main categories: neurological, nerve damage, Parkinson's disease, or poor blood supply to the brain; orthopedic, arthritis, hip or knee problems, and poor muscle tone; systemic, issues like heart failure, breathing problems, obesity, or even poor nutrition. And most seniors don't just have one issue. They often have a mix. That's why leg pain can be so tricky to diagnose. Here are some red flags to watch out for: a shuffling, duck-like walk, could be hip joint disease or muscle weakness; a person dragging one foot or swinging their leg; possibly nerve damage, leaning forward and walking quickly; could be Parkinson's disease or related conditions; short strides and difficulty getting started; may be related to brain function. These changes might seem minor at first, but they can be a sign of something serious. Always consult a doctor, especially if the changes are sudden or worsening. Older patients often have multifactorial gait disorders, decreased visual acuity, osteoarthritis of the hip and/or knee joints, vascular encephalopathy, etc. If you notice that your elderly relative has developed a so-called duck gait, shuffling from foot to foot, swaying when walking, this may indicate an acquired hip joint disease. This gait is most often observed in myopathy, a group of diseases in which the metabolism in the skeletal muscles is impaired. Weakness of the thigh muscles, proximal muscles, causes the patient to walk with a waddling gait. Here's something fascinating. Did you know walking speed is actually linked to life expectancy? That's right. Studies show that the slower an older person walks, the more likely it is that they'll need assistance soon, or worse. As we age, our stride becomes shorter, our feet may spread farther apart, and we rely more on muscles that don't tire out as quickly. This leads to a cautious, sometimes wobbly walk. But don't lose hope. Knowing this is half the battle. You can do something about it. So, what can you do to fight back against leg pain and walking trouble? Start by staying active. Regular movement, even just walking around the house, helps. Stretch and strengthen your legs with gentle exercises. Get proper shoes, supportive, non-slip soles. Don't ignore balance training. Tai Chi or simple one-leg stands can work wonders. And always, always talk to your doctor if you notice changes. Remember, your walk talks, and we have to listen. That's all for today, my dear friends. I hope you now understand just how important our legs and our gait are to healthy aging. If you found this video helpful, give it a thumbs up and don't forget to subscribe to the channel. We have a lot more wisdom to share. And in the comments, tell me, what do you do to stay active? Until next time, keep walking, keep smiling, and keep learning. Bye-bye.